Hello there, welcome back for another exciting installment of As the Body Works. No, I'm kidding. I'm very washed out because I have a very sunny sliding glass door behind me. And it feels good in my back, so I'm staying here. So I'm like a ghost with a voice. Anyway, you're not here to listen to me babble. It's a quiet Sunday morning here. I'm kind of liking it. Trying to find some peace. I'm sure you guys know the feeling. But we are here to talk about chapter 9, which is joints, which are body articulations. That's the kind we're talking about today, in case you were getting excited. Don't. No. It should be just a couple lectures, nothing too crazy, because it's just a lot of vocabulary and working the vocabulary and kind of just an organization of body parts. So there's no mechanisms like there was in bone tissue. You know, it's some anatomy, but then just kind of organization of this type of joint is here, it's this called this. But hopefully you guys have learned your bones, because bones are here for a little while. They're not going anywhere for a couple more chapters, because joints are where bones meet. So you need to still know your bones, and if you didn't learn them, you're just going to struggle. And then also for the next chapter with muscles, skeletal muscles cross bones. So we will still be talking about bones for a few more chapters. So please learn your bones. I think I've stressed that enough. All right, well, let's get this party started here. And of course, I need to itch my nose, and I'm going to try not to. I was looking the PowerPoint over, and I'm just wondering when good breaking points are. So we'll see. Okay, I'm totally itching my nose, whatever. Always happens when I'm being recorded. So joints. Joints are articulations. And we're just going to dive right in because it's all vocabulary. I don't know if I can move that. Can I? Because I can. Okay. That way I'm not half and half. I don't know. It doesn't matter now. All right. So this chapter, so this is lecture 1 for chapter 9. And we're going to probably cover some organization of joints and some specifics for 2 of the 3 categories. And then have a whole separate lecture on synovial joints, okay. All right, a joint is where, well, we have 3 different types of joints structurally. So I just said it's where 2 or more bones come together as a joint, but it can be cartilage joining 2 bones. Those are cartilaginous joints. And I don't know, teeth and bone, because they don't, like, teeth are part of your skeletal system, but they're not considered bone. They're slightly different material. Alrighty, so we can, when we talk about joints, see, I'm having joints and bones. I need to slow down. They can either be discussed structurally, what are those joints made of, or functionally, what type of movement is allowed. And we're going to go over both and link them together. So structurally, it's going to be, oh, wonderful. The bottom's cut off and I can't change that window. Nope. All right. Well, sorry about this, guys. Structurally, you can have fibrous joints, and fibrous joints are 2 bones or a bone and a tooth that is held together with connective tissue, and there's no cavity, right? No joint cavity, we'll say. No joint cavity. Cartilaginous joints is my next structural type, and cartilaginous joints have cartilage between the bones. Again, no synovial cavity. We'll talk about it when I get there. I jump in the gun. And then we have synovial joints. And, oh, hey, synovial joints have a synovial cavity. That's what's cut off here, and I'm really sorry. That says possesses a synovial cavity. So yes, synovial joints have synovial cavities, and they have a whole capsule, kind of a whole separate anatomy in a synovial joint. So we'll get to that. They're the most numerous in the body. So that's structural. I'm not ready to talk about this. Functionally, you can either allow no movement, meaning you're synarthrotic. You can have a little movement, meaning you're amphiarthrotic. Or you can be freely movable, meaning you're diarthrotic. So that's functional characteristics. I'm trying to find the pen here. So if we go back and we say allow no movement, those are typically the fibrous joints. Most fibrous joints are synarthrotic. So some fibrous joints are amphiarthrotic. They allow a little movement, but mostly it's cartilaginous joints. And allow a little movement. And those that are freely movable are synovial joints. They are diarthrotic. Okay, and we're going to be talking about movements, and they're going to be planes that are involved. So now let's start diving in, or maybe we will talk about synovial as well, because otherwise this is like going to be done in 2 seconds. What was that? I'm going back and forth here. So this just gives you an overview, but we're about to go into it, and we're going to, that's just kind of an overview table if you're looking for one. But let's dive into the specific types. So in fibrous joints, they don't have a synovial cavity. They're held together with fibrous connective tissue, permit little or no movement. So they're either synarthrotic, I said there's a lot of vocabulary, or little is amphiarthrotic. Okay, that was from the last slide. And there's 3 types. There's sutures. There's this one, and I can't stand it. It's syndesmoses. We're just going to know it by where it is. And there's an interosseous membrane. All right, so sutures. Sutures are the joints between skull bones, and they are typically, once solidified, immovable, synarthrotic. But you have this other sutural ligament in other places, and it has a little bit of movement. You can't see because it's cut off. And it says slight movement, so that means that this guy's amphiarthrotic. All right, you know what I'm trying to write. Moving on. Little movement, I'll say. But I hate to even put this on here. This is the first year I'm even acknowledging it. For the most part, sutures are immovable, okay, synarthrotic. And you find sutures between skull bones. The other type of the other type of fibrous joint is called a syndesmosis. I don't like that word. And I would rather you know that there's 2 different types here. There's this short little bit of ligament at the distal end of your tibia and your fibula, your lower leg bones, and that is another type of a fibrous joint. So you can say, hey, instead, I'm trying to cut out some of the vocabulary. If you don't want to know it as a syndesmosis, just know it as fibrous joint is at the distal end of your tibia and fibula. So remember, distal ends at the bottom, so they're talking about this one right here, not this guy up here. The other one is your tooth socket. That's called a gomphosis, but you can just know it as your tooth socket. So if you start learning them just by names you're comfortable with, the first one we had was a suture in the skull bones. The second one you have is at the distal end of your tibia and fibula. The third one is your tooth socket. And then the fourth one is known as an interosseous membrane. And this is a sheet, fibrous connective tissue. It's a sheet tissue. And it's between the tibia and the fibula. And it's also between the radius and ulna, giving them some stability. All right, so if we break it down and take out that one fancy vocabulary word, then there's 4 types of fibrous joints. There's a suture, there's the interosseous membrane, and then with this guy, there's the distal tibiofibula joint, and there is the tooth socket. Okay, so that one we're going to break into this guy and that guy. All right, that's it for fibrous joints. Not too much. Just kind of know fibrous joint, little to no movement, usually no movement. The only ones that have no movement, well, I guess they're just reading this and it says cartilaginous joints also could permit no movement. But they're typically a little bit more movable. And then the 4 types. So with cartilaginous joints, there's 3 types. They also don't have a synovial cavity, and the bones that they're joining together are bicartilage, and they are amphiarthrotic or synarthrotic, permit little or no movement. And there's 3 types. I know some of this vocabulary, I feel really bad. There's a synchondrosis, a symphysis, and the epiphyseal cartilage. Synchondrosis is cartilaginous joints that are made out of hyaline cartilage. A symphysis, we've already seen a little bit on the skeleton, is a cartilaginous joint made from fibrocartilage. So hopefully you're like, wait, I know where there's 2 places of fibrocartilage in the body. And the epiphyseal cartilage, hopefully you're thinking, well, the epiphysis is the end of a long bone, so that might have to do with that. Or maybe you're not. Okay, so I just want to see something. Okay, a synchondrosis, I like to kind of make it a little simpler. So this is hyaline cartilage joining 2 bones. And an example of this, they're just saying between the first rib and the manubrium. Let's just say that it's between ribs and sternum. It's not altogether correct, but I'm okay with that. We're 100 level. Okay, the pubic symphysis, the symphysis is the second one. That is fibrocartilage. And you have that at the pubic symphysis, and you also have that at the intervertebral discs. They are also fibrocartilage. Okay, so that's the first one, hyaline cartilage. The second one, fibrocartilage. And this third one here that you can't see because it's cut off. There's a reason it's cut off. I need the screen smaller. It's called epiphyseal cartilage. It's hyaline cartilage. I'm hoping that this picture looks a little familiar to you because it's at your growth plate. Okay, so it's at the epiphyseal plate. And it gets its whole own little catalog, its own little category, not catalog. I've been shopping. No, I actually haven't. It gets its own little category, and this one should be immovable. Okay, that's why some cartilaginous joints are immovable, and it's because of this. Okay, the symphyses made out of fibrocartilage are slightly movable, and here's the 2 examples that we've already talked about. And then the synchondrosis, which is made out of hyaline cartilage between the first rib and sternum, can either be slightly movable or not movable at all. And those are my cartilaginous joints. There's 3. So fibrous joints, there was 3, we broke it into 4. because there's too much vocabulary. And then cartilaginous is 3. So my third category of joints, okay, there's categories, and then within each category there's types. So keep that vocabulary straight. Is my synovial joint. Yeah, I'm going to keep going because it's only 15 minutes in. I'm starting to smell my banana bread that's baking, by the way. It thankfully is overriding the gross bean smell I also have going on because I'm doing work. What? Go outside, babes. You see their doors open so cats go in and out. All right. The third type, our little break there, is a synovial joint. And synovial joints all have a synovial cavity. All are classified as diarthrotic. Remember, that means they are freely moving. And a synovial cavity, they have, where is it called? An articular capsule. These are the anatomical features of a synovial cavity, and we're going to look at them. So they have a capsule. Contained in the capsule, you have hyaline cartilage covering the ends of the bones. You have a synovial cavity filled with synovial fluid, and all of this to reduce friction and absorb shock because we put a hurting on our synovial joints. We also have accessory structures to a synovial joint. We will have ligaments. We will have ligaments and tendons across these synovial joints. We might have this other structure called a meniscus, and the plural is menisci. And what that is cartilage that helps form and stabilize the joint cavity. You have menisci in your articular menisci in your knees. We're going to look at that. I'm not testing on any of those specific joints, but we'll take a quick peek at them. Stabilized joint. And then you have other structures in there cut off. This on the bottom is saying they're bursae and tendon sheaths. And bursae and, tendon sheaths. Sheaths reduce friction, and we'll see that in some examples as well. Oh, right. So loading so slowly. I just want to go, oh, brother. All right, well, so this articular capsule has 2 layers to it. It has an outer fibrous layer that will have the periosteum that will this outer fibrous layer of the dense connective tissue, you will have ligaments that dive into the periosteum of the bones and form like the outer layer of this cavity. And that is to stabilize the joint. And the inner layer is a synovial membrane, and it will make synovial fluid. Okay, the synovial fluid nourishes the cells in the joints, right here, the cartilaginous tissue that doesn't have any type of blood supply. It's to reduce friction, absorb shock, remove the waste, and keep it clean, man. Have some white blood cells to clear out the debris and whatever they find. All right, this is what I was looking for. And so this is taking a joint. So it looks to me like we're diving into 2 phalanges. So here's bone number 1, bone number 2, and there's this little space between them. So I have the outer fibrous layer. I can't even begin to draw with this stupid thing. That's this thing here that I'm kind of covering in. And that's the outer layer, right? The fibrous one. And inside it, I guess in the pink, is the inner synovial membrane. No. And the synovial membrane makes synovial fluid. Oh, son of a gun. This is why I just... trying to hold the pen at a certain angle. Obviously, it's not working. Make synovial fluid. Okay, and that synovial fluid is going into this joint cavity right here. I have the articular cartilage, remember that's hyaline cartilage, covering the ends of long bones, all in an effort to reduce friction, because if bone rubs on bone, it stimulates bone growth. It's stimulating those osteoblasts to lay down bone, and we don't want bony knuckles. It's going to happen, but not if I can help it. All right, then I have structural accessories, kind of like wearing a scarf. It's an accessory, and that's going to be ligaments. Ligaments attach bone to bone. We've been using that word a little bit. I'm trying to find my pen. Oh, here it is. Ligaments will hold the bones close together to help stabilize a joint, and then the menisci is fibrocartilage. To also help stabilize the joint. Okay, that's kind of cool, and tells synovial fluid where to go where there's super friction. Bursa and tendon sheets are what you have. I just wanted to point these out. Bursa are little fluid-filled sacs, like this guy in the shoulder. So this is a picture of the shoulder joint. And they're placed between bones. Tendon sheaths are wrapped around tendons so that as tendons and bones move across each other with movement, you don't have, it reduces friction. Cushion movement as they move over one another. And then tendon sheaths are where tendons might be rubbing against each other with different muscles, and so you kind of pad them. It's like putting paper between dishes when you're moving, if you've moved and packed boxes. All right, so this is also, here is a picture of the knee. I'm looking for my pen. Here it is. So this picture here is of the knee. And here's my femur and my tibia and my fibula. But what I wanted to show you is this little patch here has the meniscus, a medial meniscus and a lateral meniscus, and those are fibrocartilage to stabilize and help form that joint structure. It's crazy. Okay, do we need to really talk about this? I don't think so. Is there a picture? No. All right, so this is just some vocabulary, but really it pertains to muscles. If I have, all right, so let's see if I can draw. If I have the humerus, and then I have the ulna, and the radius, horrible drawing, I know, and then here's the hand, I will have a bicep. And a bicep goes across the elbow, and it's attached at two ends. Okay, so the bicep is your big muscle in your arm. The end that's attached, so when I contract the bicep, where did my pen go? Oh, sucker. I'm not done talking about this. I'm trying to write and, Nothing is cooperating today. It's telling me to go to bed. When I contract this muscle, it makes my lower arm move toward my upper arm. It decreases the angle between two bones. Okay, so I'm going to talk about that in a minute. The bone that doesn't move when I contract this muscle is called the origin. Okay, because that's the bone that doesn't move. The radius moves when this muscle contracts, and that is the insertion. So when muscles contract, insertion moves toward origin. Okay, insertion, this bone here moves toward origin, and that's what that is talking about. I got to pause for a minute because my banana bread's almost ready. All right, so guys, I'm back. Took the banana bread out of the oven and it was ready and it smells really good. But I realized that I probably should stop here because we've covered the 3 types of joints in the body: fibrous joints, cartilaginous joints, and synovial joints. And we've talked about the structure of a synovial joint, so I actually want to stop here. It's a good breaking point, and come back where we'll just be talking about synovial joints for the duration. So sorry about that. I came back just to say goodbye. All right, see you later.